Good morning, good afternoon, good evening, everywhere you're watching this video from. We are back again on ML Turo's channel. Today we are going to talk about hepatitis B because on our previous video we said that we'll talk about hepatitis B in the next video. So now, what is this hepatitis B? Hepatitis B is a viral infection that harms the liver. It's one of the infections that harms the liver. We say that people have liver cancer or it's hepatitis B. One of the reasons that cause this liver cancer. It spreads through infected blood or body fluid. We have two main possibility of hepatitis B. We have the acute hepatitis B and we have the chronic hepatitis B. The acute hepatitis B goes away on their own. They might come normally, if you treat it, they will go away. But this chronic hepatitis B is the one that causes liver cancer when it stays long in the body, and you need regular medical treatment. Seriously, regular medical treatment, because it's diagnosable. You can diagnose it, but when it leads to the last stage of liver cancer, you are going to die. There is no two ways about it. So it's possible and it's important for us to be getting a regular medical checkup for this hepatitis B. This chronic hepatitis B, how it develop in the body, you cannot just go into chronic hepatitis B and lead to cancer. It has stages, and that is what we say: the first stage, second stage, and the last stage of cancer. The first stage is the chronic inflammation. You will start having a swollen in the liver, chronic. Then from this chronic, if we do not treat it very well, it will now start repeating injury, to now start having injuries. The chronic is the injury. Start having this injury, repeated injury, which is fibrosis. Fibrosis is the scarring, the injury. Once this chronic inflammation starts repeating, it's now go to the second stage of fibrosis, which is the scarring. Then from this scarring is the several scarring, like when you have 1, 2, 3, 4, 5 injury in the liver. This is where this fibrosis comes, the second stage of cancer. Now it will now go to the last stage of cancer, which is the liver failure or liver cancer. We call it cirrhosis. So which is the last stage of this liver cancer. You can treat the chronic inflammation, can help treat the fibrosis, which is the scarring, the second stage. But once it's got to this last stage of liver failure, liver cancer, no more. It's just to be diagnosed. That's the thing. You just be diagnosed and wait for the day of your death. That's the thing. So someone can have this hepatitis B without feeling sick, especially during the early stage. This chronic inflammation, you will not feel it. That is why it's important to be checking yourself. Every possible time, because you will not feel it. It's when you now go to the second stage, which is the scarring. Then you start having small feelings. The common signs you start having is yellow eyes, which is the jaundice, yellow skin eyes, the jaundice, feeling very tired, belly pain or fever, dark pee or poo or pale poo. Start having dark pee, dark urinate or pale poo, upset stomach or no hunger. When you get to this second stage, that is what you start having. How can somebody contact this hepatitis B? We have hepatitis A, we have hepatitis C, we have hepatitis B. So we're talking about hepatitis B today. People say, how can someone contact hepatitis B? 1, infected blood, sharing needle, unsafe infections, or contact with contaminated blood. Some working in the hospital, especially we lab personnel, if you are not being careful, can be contaminated with blood in the process of collecting sample. You can be contaminated So it's possible that you contact it. If that is why, if you are collecting samples in the lab and mistakenly you were pricked by the needle, just have to rush and go and test yourself and take preventive pills in case. So secondly, you can contact it with unprotected sex contact, mother to child transmission during birth. If a mother have hepatitis B, definitely during childbirth the baby will have it. Then thirdly, sharing razor, toothbrush, you can still contact it through that. Unsterilized, tattooed, piercing of nose or medical equipment. As I said before, we lab tech personnel, we we are prompt to contacting it. You get. Then this hepatitis B, after the hepatitis B enters your body, it reaches the liver and infects the liver cell, which is a hepatocyte, the body immune system that tries to destroy the infection cell. The immune response causes inflammation and damage the liver. That is where this chronic inflammation comes in. When hepatitis enter your body, it swim directly to the liver, and then when our immune system try to fight this cancer, this disease, that infection that enter your body, that is where you start having injuries in your body. Start going to the second stages of these repeated injuries. You get. So when this thing start having this injury in the liver, get, this also increase the risk of hepatocellular carcinoma, which is the primary liver cancer. This is the chronic inflammation, is the primary liver cancer. Then this last, the fibrosis, is the primary liver cancer because when the immune system start fighting the infection that enters your liver, that is where the inflammation starts, the injury in the liver, that's the inflammation. Then when it now goes to the second stage, which is the fibrosis, is the primary liver cancer. It increases the risk of hepatocellular carcinoma, which is the primary liver cancer. Then from that second stage, it will go to the last stage. The last stage, which is the cirrhosis. Cirrhosis is when the liver becomes heavily scarred and is normally structured. Its normal structure is altered because our liver have a shape. So when the shape is altered, that is, that the possible sign you will be seeing when the shape of your liver is altered is swollen abdomen. You see somebody that have swollen abdomen, legs swollen, easy bruising or bleeding, any little thing, bam, you have contracted bruising, you have wound yourself. Then join this confusion in advanced diseases. That is the thing. That is the early thing that you'll be seeing when the liver goes to the last stage. Then from this last stage, now go to the liver failure. The damaged liver can no longer perform its functional adequately. That is where it now goes to the liver cancer. Liver, we all know that liver is a large processing and cleaning factory of our body. It's a large process of cleaning of our body. Say it helps. One, what the liver does in our body. One, it helps process nutrients, store energy, produce important protein, produce medicine and chemicals, produce bowels, helps control blood clotting, and produces bilirubin. So when the liver is altered, it can no longer function these responsibilities in your body. That's where you start having liver failure and liver cancer. So my advice to us is that we should try as much as possible to be checking ourselves in regular basis for this hepatitis B, because hepatitis B kills silently. It kills us silently. You won't know, you won't feel that you have it. So please, let's try and keep ourselves safe. Thank you. Please don't forget to subscribe, like, and share in this video. Help others so that we can help ourselves in the society. Thank you.